Hi, my name is Dr. Joseph Licata, and I have been a pediatrician in New York City for over 40 years. And I have a particular interest in uh, preventing tick-borne illnesses by the proper removal of ticks. Um, I've worked at Global Pediatrics for these last 40 years. So I made this PowerPoint presentation that I hope you find interesting and informative about ticks. Ticks are second only to the mosquito for spreading disease and even death. Mosquitoes are number one because of such illnesses as malaria, yellow fever, dengue fever, encephalitis, and Zika virus that they spread mostly in other countries. We're going to be talking about hard ticks. There are two types of ticks, soft ticks and hard ticks, and the hard ticks are characterized by having a dorsal shield. And ticks vary in size depending on their life cycle stage and if they have been feeding, causing them to become engorged. We'll go through that as the PowerPoint progresses. Most ticks have 4 life stages: eggs, 6-legged larvae, 8-legged nymphs, and adults. And at each of these stages, they have to have a blood meal in order to progress to the next stage. So after they hatch and are larvae, they feed on small animals like birds and mice. And once they feed, they molt into the nymph, which is an 8-legged organism. And then they feed again on larger animals, sometimes humans, and this is when the risk of infection is actually greatest for humans being bitten by a nymph. They then molt once again to an adult, and then they go and feed on usually a deer, and the female not only feeds, but actually mates, and then falls off and lays its eggs, and the cycle starts over again. It can take up to 3 years for a full life cycle. Most ticks actually die before they find a host for their next feeding, so they have a pretty hard life. I've also put together some geographical distribution of the different ticks. These maps provide a general insight into the expected distribution of ticks that cause disease in the contiguous United States. Populations of ticks may be found outside these areas. Naturally occurring populations of ticks described do not occur in Alaska. However, the brown dog tick is found in Hawaii. So for example, the American dog tick is mostly from central to the northeast and also in California. The black-legged tick, which is the one that we're most concerned with in terms of Lyme disease here in the Northeast, is also found from the south to the northeast of the United States. The brown dog tick is pretty ubiquitous in all of the United States. The Gulf Coast tick, again, in the Gulf Coast area of the United States. There is a Lone Star tick, which is becoming more prevalent, and that too is from the south to the northeast. The Rocky Mountain wood tick in the Rocky Mountains, and the western black-legged tick in the western United States. So ticks feed on different animals. They feed on amphibians such as frogs, as you can see there. They feed on birds. They feed on reptiles like lizards. They also feed on mammals such as rabbits, on dogs, on deers, and of course, on humans. So this young lady in the last picture exemplifies exactly what you should never do. Improperly dressed, in high grass, no insect repellent, in a tick-infested area, just asking for a tick bite. And in case you missed this tick bite, That's where it was, right there on her leg. So how do ticks find their host? Well, ticks have sensory pits called Haller's organ on their front legs that can detect an animal's CO2 that is given off when we breathe. So they can detect our breath, they can detect chemical odors, body heat, moisture, vibrations. Ticks cannot fly or jump, but they can quest. And what does that mean? Quest is when they climb up a blade of tall grass, outstretch their front legs, and wait to grab onto a passing host. This is a Lone Star tick in the questing position, and a black-legged tick also in the questing position, just waiting for you to brush up next to it so that it can grab on and have a meal. So how do they feed? Once a tick finds a place on a host to feed, it secretes saliva with an anesthetic property to lessen the host's awareness of the tick. It's just amazing what they're able to do. And then it inserts its hypostome into the host, and at that point secretes an anticoagulant to keep the blood flowing. This is the hypostome. In addition, once the barbed mouthpiece is inserted, a cement-like substance is also secreted around the mouthpiece to further keep the tick attached. There's a video here that shows exactly what they do. So a tick secretes its anesthetic property, inserts the hypostome, secretes cement around the hypostome, and then an anticoagulant. That anticoagulant allows the blood to keep flowing. And depending on how long the tick is attached, it continues to feed and potentially shares its contents with the host. The contents could be a tick-borne illness that it picked up from its prior host and therefore sheds it into this host. Once it finishes feeding, it's engorged, filled with blood, it falls off, and then molts into the next stage in its life cycle. It is quite interesting the way that they are able to feed, trying to minimize our awareness of their presence on our body. Once the tick feeds, it becomes engorged. And you can see this is a deer tick, how small it is and how large it becomes after feeding. And as I said, it drops off and prepares for the next stage in its life cycle. Most ticks prefer a different host for each stage in their life cycle. I'm just going back and showing you that, again, those smaller animals when they're larvae, larger animals when they're nymphs, and then deers usually when they are adults, when they prepare to mate and have eggs again. It's during this feeding process that a tick can pick up the disease from one host and transmit it to another host at its next feeding. Usually an attached tick, if it's usually 24 hours or less that you can remove it, the risk of infection is greatly reduced. That is why prompt and proper removal of a tick is so crucial in preventing the transmission of tick-borne illnesses. Proper removal is what I say, or what I call the exit before the toe. It can be the difference between just a tick bite and a tick-borne illness. So how can you prevent tick bites? Well, you can wear light-colored clothing so that you can see ticks on you when you're outdoors. And before going outdoors, you can repel ticks by putting tick repellent that contains DEET on your skin and clothing. You can avoid areas with high grass and leaf litter. And if you're hiking, you can walk in the center of the trails. You can also, at home, in your yard, use certain pesticides, but you should check with the EPA as to which ones are approved for use in your home and the yard area. You should clear tall grass and brush around the home. Create a safe zone around your yard and home with wood chips or gravel between the lawn and the wooded areas that may abut your yard. Remove the leaf litter and trash from your yard. These are areas that ticks love to be in and protects them from the elements. You should also mow the lawn frequently in an attempt to keep the grass short. This is another thing that you can do. You can treat your clothing with permethrin. This is a great substance to really prevent ticks from getting on your clothing when you are going to be hiking or in the outdoors. And the way you do it, this picture exemplifies this young lady protecting her clothing with, or pre-treating it and protecting it from ticks. You have to do this outside. You apply it following the instructions in a well-ventilated area. You can spray on the permethrin. Once it dries, okay, then any tick that gets onto those clothing actually dies in contact. So, and it lasts for about 5 washings. You can buy pre-treated clothing, or you can pre-treat the clothing using permethrin that you can buy in hardware stores and sporting goods stores. Of course, when you come home, you should bathe or shower as soon as possible after coming indoors, and you should examine the gear and your pets for ticks. Another good idea is to tumble dry your clothing at high heat for 10 minutes, which will kill any ticks that may have attached to your clothing that you're unaware of. And then you should conduct a full body tick check, and especially in children, you should do that in the morning and in the evening, so that if you happen to miss a tick in the evening after they've come in from outdoors, by that morning that it may have attached and started to feed, you will find it, but it will only have been a 12-hour period, let's say, and then you can find it and remove it properly. And these are some of the areas that you should keep in mind to check: under the arms, around the ears, belly button, behind the knees, between the legs, around the waist, and especially in their hair. I also listed the multitude of tick disease, tick-borne illnesses that ticks can give. I'm not going to go into each one of these, but just so that you know how varied an array of illnesses that they can transmit: anaplasmosis, babesiosis, Borrelia, Bourbon virus, Colorado tick fever, ehrlichiosis, heartland virus, Lyme disease, Powassan disease, rickettsia, Rocky Mountain spotted fever, southern tick-associated rash illness, tick-borne relapsing fever, tick paralysis, tularemia, 364D rickettsiosis. So you can see quite a lot of different diseases, but many of the tick-borne illnesses have similar signs and symptoms, and fever and chills, aches and pains, and rash are common to many of those illnesses. So with all tick-borne illnesses, patients can experience fever at varying degrees and different times of onset. Tick-borne diseases symptoms include headache, fatigue, muscle aches, Lyme disease. With Lyme disease, you may experience joint pain. The severity and the time of onset of these symptoms can depend on the disease and the patient's personal tolerance level. Rashes are often associated with Lyme disease and southern tick-associated rash disease illness, Rocky Mountain spotted fever, ehrlichiosis, tularemia. And this is erythema migrans, which is found in 70 to 80% post a bite in Lyme disease. It usually occurs anywhere between 3 to 30 days after. It's another You can see that this is a target-like lesion, bullseye lesion, as they call it. It's not always present, but when you see it, it should certainly alert you to the possibility of a Lyme disease. This is a particular rash that's seen in Rocky Mountain spotted fever. Particular rashes are little hemorrhages underneath the skin. So these rashes do not blanch. If you were to press onto this rash, the lesions last because those are little hemorrhages underneath the skin. Also, another example on the back from the CDC. And tularemia, there are different types of tularemia, but this is a ulcer glandular form, and there is a rash where the disease enters the body. So let's say despite all of these prevention methods that you've employed, you find a tick attached on you. So, what should you do? Do you use a match to burn it off? Do you just pull it off with your fingers? Do you use Vaseline to smother it off? Or should you use your eyebrow tweezers to pull it off? Or should you use a crowbar to pry it off? Well, using a match doesn't look like it's a very appropriate thing to do because, again, an engorged tick with heat applied to it can burst and spread even more disease. If you use your fingers, these ticks are pretty small. So squeezing the tick, think of it as a little eyedropper. So the last thing you want to do is squeeze the tick because it's just injecting into the patient or into the host exactly what you're trying to prevent. Maybe some people say put Vaseline on it so you smother it and it gets irritated enough that it'll detach. Well, in that irritation, it could cause it to regurgitate even more of its contents, again, spreading disease. And what you have to be careful is, even though the CDC recommends tweezers, you don't want to use your eyebrow tweezers to remove it because the eyebrow tweezer can be so big and the tick can be so small that it's actually like using your fingers to remove this tick. And again, it squirts it into the patient and you are not avoiding the thing you're trying to avoid. So this is a special moment in the prevention of disease. So when you find a tick attached to you, stop and think first. Don't crush the tick. Do not squeeze the tick. Do not irritate the tick in any way. So what is the correct method for removal of a tick? The CDC recommends a fine tip tweezer to grab the head of the tick and gently pull up in this picture as shown. So I find that this is good in theory, but these ticks are very small. And grabbing the head only of a tick, you have to have a fine tweezer. You have to be a jeweler almost to have those kind of tweezers on hand. So just remember that if you're going to use a tweezer, that you do it in the recommended way. Personally, I prefer a crowbar. Yeah, a crowbar for ticks, that is. Dr. Joe's Tick It Away is one of these items. And I found it is exactly what you need to do the job properly, with less risk of crushing or irritating the tick. In fact, I invented a tick remover exactly for this purpose. I remember a young lady who had a tick on her, and for the life of me, I could not get this tick off. And so I was using everything I had in the office to try and remove it. And as I was trying to remove it, I said, you know what, I need a crowbar to take this thing off. And it was like a paradigm shift. I realized, oh my God, I don't think there's any crowbars that do this kind of job. And I went home, fashioned a tick remover out of a aluminum Coke can and used it the next time I encountered a tick, and it worked. So I said, this is the right way to do it. I patented, I got it produced, and now I use it all the time, and I market it, and it's in stores. This is how it works. So you see, there's no risk of crushing the tick or irritating it. You just put the tick into the groove, push it all the way down into the groove, push down on the back of this tick remover, and you're able to extract the tick much easier than any other method. There are several of these tick removal devices on the market, and I think most of them work pretty well. So after you remove the tick, you should wash and disinfect the bite size. You want to clean it with either some alcohol or betadine to kill any potential organisms that are there. You should wash your hands, save the tick in a small container of alcohol or a small Ziploc bag. You label it, put the date, time, geographical location where the bite occurred, and you use this for further identification. And you should call your doctor for further instructions, which they may have a particular way that they want you to handle the situation. After removal, should you have the tick tested? No, because whether or not the tick is carrying a tick-borne illness does not mean that it transmitted it to the person it bit. It depends on the amount of time that the tick was attached, how it was removed, etc. So that's why prompt removal is so important, more important than knowing, what organisms might have been in that tick. Should you take prophylaxis? Well, for Lyme disease, the CDC recommends that if you or your child are bitten by a black-legged tick or the deer tick, if the tick has been attached for more than 36 hours and it is engorged, and if you've gotten the tick in a Lyme endemic area, then you should take prophylaxis. Lyme disease prophylaxis is recommended. And it is 1 dose of doxycycline, and it has to be given within 72 hours of the removal. And that may prevent Lyme disease altogether. And that's basically it. Thank you for your attention. And I thank the CDC for all their information and wealth of knowledge. So be careful out there.